Okay, thanks, Laura. I'll start. And I see now we have about 34 members joining us. That's wonderful. My name is Tim Rowe. I will be your facilitator for today's webinar, Aging in Uncertainty, the Growing Crisis for BC Seniors. Currently, I am the co-chair of the Seniors Housing Working Group that was very much involved in the development of this report. I am based in Chile, Prince George at the moment. My co-chair colleague is Deborah Hollins, who is part of the Nanaimo Life Family Association based in Nanaimo. So welcome, everybody. I look forward to the conversation we're going to have for the next 90 minutes. Next slide. I wish to acknowledge the homelands of Indigenous peoples of this place, now called Canada, and honour the territorial keepers of the lands on which we work. Next slide. So today's agenda is as follows. Basically, I will be doing an introduction and providing some background information. And then we'll have reports, highlights from Laura. Laura Kadawaki is the Program and Operations Coordinator for the United Way of British Columbia. She has a PhD in gerontology from Simon Fraser University, though her work as a researcher with the Raising the Profile project and United Way BC, she has worked extensively with community-based seniors services sector for the past 8 years. So Laura will be providing some highlights from the report, which will be available to everybody. Then we will look at two community perspectives on what the seniors housing precarity crisis looks like on the ground from Wendy and Ian. Wendy is based in Langley. Wendy Rauchalski is the manager of community services at Langley Seniors Resources Society, which is a large seniors community centre in BC. She has been in the position for about 11 months. She has a passion for seniors. 10 years ago, Wendy made a change in her career from financial project management to general manager roles in the retirement industry. And then a second perspective on what the seniors housing precarity crisis looks like on the ground is from Ian, who is actually based in Kelowna. And Ian Gibrant is the Executive Director of the Seniors Outreach and Resource Centre in Kelowna. He has managed a variety of non-profit social services for 25 years and has worked with organisations like Boys and Girls Clubs, Big Brothers, Big Sisters and United Way. Ian has worked with senior services for the last 7 years in Kelowna and Penticton. Following the two perspectives from Ian and Wendy, Laura will then provide a summary of the report and recommendations, and then we'll have a second community perspective on how the report is being used to support local advocacy. And again, we'll ask Ian and Wendy to share their perspectives from their respective communities on this particular topic. This will be followed by a group discussion about advocacy, priorities, and next steps, and then we will conclude with closing remarks. So a little bit of introduction and background to the work that we've been doing and who's been involved. Next slide. The Seniors Housing Work Group. Today's presentation is based on a report that was prepared by the United Way, British Columbia, and the Seniors Housing Working Group, which is a committee of the Community-Based Senior Services Leadership Council. The Community-Based Senior Services Leadership Council is a representative body of older adults and leaders in the not-for-profit and municipal-based senior service sector in British Columbia. Next slide. This report was authored in response to concerns from frontline CBSS, who have been concerned in recent years by the escalating number of seniors who are homeless or on the verge of homelessness. The goal of the report is to highlight the severity of the seniors housing precarity crisis and advocate for policy and programme changes that will address the main causes of senior homelessness in British Columbia. So what I'd like to do now is ask Laura to provide some highlights from the report. Thank you.
All right, thank you very much for that introduction, Tim. And this report I had the pleasure of being an author on, and I co authored the report with Gemma Bridgefoot, who's another United Way BC employee, and then also Marcy Cohen, who was the chair of or the co-chair of the CBSS Leadership Council. And so I really would like to thank them for all of the work that they did on the report, as well as the Housing Working Group, the co-chairs, Tim and Deb, and the many other people who contributed to the report through interviews or sharing information, because it was quite an undertaking to develop it. So I'm going to provide some highlights from the report. And to start off with, I just want to talk a little bit about framing of the issue of housing precarity, because I think it's really important to emphasize that housing is a human right. And this is something in the report that we use as a foundation, the fact that everyone has the right to access safe and affordable housing. And this is a basic human right that has been recognized in the 1948 United Nations Declaration of Human Rights. And of course, Canada is a signatory to this convention. And then more recently in 2019, the Canadian government actually passed their National Housing Strategy Act, which states it's declared to be the housing policy of the Government of Canada to recognize that the right to adequate housing is a fundamental human right affirmed in international law. And then, in addition to housing being a human right, we also know that there's really strong links between housing and our health. And so there's a lot of research that suggests housing is a key social determinant of health, and it's linked to health outcomes such as mortality. So if you experience housing precarity, you have higher instances of mortality. Housing precarity also is linked to other negative outcomes such as activity limitations or chronic conditions or mental health conditions such as depression. And there's a number of different ways that housing might impact our health. So for example, if you're living in substandard housing that's poorly maintained or very moldy or overcrowded, of course that would potentially have a negative impact on your health. But housing can also impact our health in other ways. So for example, if you're paying so much for your housing that you don't have enough money to pay for your food or your medications, that's obviously going to impact your health as well. So there's a lot of research showing that housing is very closely linked to our health. So it's important to think about housing both as a human right, but also as a key factor determining our health and well-being. Now, as Tim mentioned, we developed this report because we were hearing from the community that they were increasingly worried, frontline service providers, about the fact that they were having more people coming to them who were seniors and were finding themselves homeless or on the verge of homelessness. And so why has this been occurring? Well, there's a few different factors contributing to the seniors' housing precarity crisis. One of them, of course, is just the fact that our population is aging. So in 2010, about 15% of BC's population were seniors, and then by 2022, this had increased to 20%. So now over 1 million British Columbians are older adults. At the same time, our population has been increasing. We've also been seeing a very significant increase in the cost of a rental in BC. And so this, of course, would come as no surprise to anyone that housing costs are skyrocketing. And you can see here in this graph that it shows with the orange line, the cost of a one-bedroom apartment, which has increased from about $871 in 2010 to about $1,432 in 2022. And if you look at the graph, you can see in the past few years, that's when we've been seeing the more significant increases in housing costs, so kind of post 2015, 2016. And this graph is just based on data from the primary rental market. So that's purpose-built rental housing. And so if you're trying to rent from, for example, a private individual who owns a condo unit or a house, that's going to be even more expensive. So I think we all know that all of these numbers are underestimates in terms of what you would be paying on the rental market. Now, at the same time, our population's been aging and housing costs and other costs of living have been increasing. We've also seen that government income benefits for seniors haven't been keeping pace with these changing costs of living. And we know in BC that about 1 in 4 seniors lives on an income of about $21,800 or less in annual income. So that's obviously a very low income. And most of these seniors are going to be reliant primarily on government income benefits such as old age security and guaranteed income supplement and the BC Senior Supplement. And if you were trying to live just on these income benefits, your annual income would only be about $1,841 a month. And so, as a result, if you're trying to rent that 1 bedroom apartment in BC that costs $1,432, you're going to be spending about 78% of your income on your housing. And the general standard is that if you're spending 50% or more of your income on housing, you're at risk of homelessness. Now, even if you're receiving additional income, so for example, maybe you receive some Canada Pension Plan income and you receive $500 a month from that, even that would not be enough to keep you out of risk of homelessness, as you'd still be spending more than 50% of your income on housing. So we're seeing really significantly that the incomes of seniors are not keeping pace with the cost of living. And this is a pretty significant change from past trends in terms of seniors' incomes. Because in the past, we did see that often government retirement income benefits, while not meeting everyone's needs, did an okay job of keeping older adults out of poverty and meeting their basic needs. But particularly in the last decade and the last few years, we've seen very significant shifts here. And so now we actually see that about 15.2% of seniors in BC are low income, which is a dramatic change from 30 years ago when seniors actually had low income rates than any other age group. So this is a significant factor contributing to the housing precarity crisis, that these benefits just aren't keeping pace. Now, at the same time, we're seeing more and more seniors who are in need of affordable housing. What we've also seen in BC is that there's been a lack of growth in seniors subsidized housing. So the seniors population, for example, over 2017 to 2022 increased by 20%. But at the same time, the number of seniors subsidized housing units, and so these are units where a person pays no more than 30% of their income on the housing. And so they're guaranteed then to be affordable. And so we actually saw that this type of housing unit, the growth in it stagnated. So there's virtually the same amount of units. And then there's another type of senior subsidized housing unit called seniors supportive housing, which is 50% rent geared to income. So you pay 50% of your income and you receive the housing and then also some support such as housekeeping or meals. And so there's been a 6% decrease in that type of housing. And then the seniors subsidized housing wait list has increased by 45%. And so why exactly are we not building more senior subsidized housing? Well, there actually have been some new units that have been built in recent years, but one of the key challenges currently is that there's a lot of units that have expiring operating agreements. And so these buildings were often built in the 1970s or 80s or 90s, and they had agreements with the federal government to fund them and to subsidize them. But these agreements are expiring. And so as a result, then we're seeing that while some new units are being built, there's also a large number of units that are being lost due to the expiring operating agreements because they can no longer afford to subsidize them. And in fact, by 2033, It's estimated that about 30,000 units of subsidized housing will have their operating agreements expire, and about 15,000 of these are seniors' units. So I've provided you with some stats and facts in order to help create a picture of what the seniors housing precarity crisis looks like in BC. But now I want to shift to talking a little bit about what it looks like on the ground based on interviews that we conducted from the report. And we conducted interviews with 16 service providers and volunteers from across the province in both urban and rural communities. And so overwhelmingly, we heard that in communities across BC, both in urban communities and rural and remote communities, that there are a number of seniors who are living in unsheltered, substandard, or unsafe housing situations. And so this was a concern for, of course, the people we interviewed, that there's an increasing number of seniors who are coming to them needing help because of their living conditions. So, for example, one volunteer said, "We're seeing seniors who are living in their cars, seniors who are living in their storage lockers, seniors who were going out to the airport. And because they were dressed kind of nice, they could spend a night out there." We also heard from service providers in rural communities as well, because I think we often might think of the housing affordability crisis as more of an urban issue, but this is impacting people from across the province, including in rural and remote communities. And so we heard about the impacts of the housing precarity crisis in these communities, and also the fact that sometimes the housing precarity crisis might look a little bit different in these communities. For example, there are people who might own their own home, but the home is in such poor repair that really it's hazardous to their health, and the senior doesn't have any income to make the needed repairs. So, for example, this quote from a service provider: "I've had people that we've just had to move into emergency housing because their circumstances are so bad. And for instance, they have inadequate insulation, a broken window, no heat except for a wood stove. And as they become more and more frail, they're not capable of managing that wood stove." We also heard from a lot of the people we interviewed that, of course, there are people who are aging who have been chronically homeless all their lives. But there also was concerns about a new trend and the fact that people were seeing a lot of people who are coming to them in their 60s, 70s, or even older. And for the first time, they're finding themselves on the verge of homelessness. And this was a significant concern because often these were people who had worked for most or all of their life, perhaps in a lower income job, but they had no reason to think that when they retired, they weren't going to have enough money in order to support them in later life. But then there's some sort of change that happens in their situation. Perhaps the person's spouse passes away, or maybe their landlord sells their house and then there's a new landlord who comes in and jacks up the rent, or maybe there's a health issue. Or for various other reasons, these people are all of a sudden finding themselves on the verge of homelessness or homeless in their later years. And so one of the quotes from a service provider here illustrates this. "We are in a housing crisis, but we're also in an income disparity crisis. And so I want to emphasize that these are folks that worked hard all their lives and provided for themselves and are now finding themselves in a place where they can't manage." The people that we interviewed also emphasized the physical, mental, and emotional toll that the housing precarity crisis has on seniors. And one of the quotes in particular that really stuck out for me was from a service provider who said, "And I would say well over half of our clients talk openly about the question of whether or not they want to live anymore and the burden that they feel like in the current system." And so it was emphasized that often these people are feeling very disappointed, let down, hopeless. They don't see any opportunity for them to find housing. They're frustrated with the system. They thought that they were going to be taken care of in later life, and they find this isn't the case. And so this is extremely demoralizing, not only for the senior themselves, but also for the service provider to see these people struggling so much and often not having the tools to help them. When we spoke with service providers about supporting seniors who are experiencing housing precarity, they talked about some of the challenges that they also encounter. One of these was the lack of support and coordination with the healthcare system. So, for example, concerns were raised about gaps in mental health services, as we often know that a mental health crisis might be a factor that contributes to a senior being evicted or experiencing housing precarity or having challenges getting housing. So this was a key concern. And there's a quote from a service provider here that illustrates this issue. There were also concerns about poor coordination of hospital discharges and examples of seniors who are being discharged after an illness to a homeless shelter or the streets because they don't have any housing. And there were also concerns raised about inappropriate expectations of homeless shelters and rental housing staff. So, for example, often at homeless shelters, the home support staff won't come there to provide services to a senior. So that leaves the untrained shelter staff to have to help a senior who might need help with bathing or eating or other basic necessities. And obviously that's not appropriate. There are also concerns about expectations being placed on rental housing staff. And for example, seniors who were living in the housing who had needs that far exceeded what was available, as often there aren't any supports being provided in these types of housing. And then, of course, overwhelmingly, the main challenge that was identified by the service providers was just the lack of a continuum of housing supports for older people. So the fact that there isn't enough navigation services or shelters or housing. So there was an emphasis on the need for more housing navigation services for seniors because there was the recognition that the current supports we have available often tend to be geared more towards people with mental health and addiction concerns or other needs rather than a frail or low income senior. It was also highlighted that the current homeless shelter system isn't serving seniors well, as there's obviously a complete lack of capacity in this sector because there's so many people who need shelter beds, but there's not enough. And then also the fact that a homeless shelter often isn't a safe or accessible place for a frail low-income senior. And then, of course, overwhelmingly, the key issue that was identified was the lack of safe and supported low-income rental housing for seniors, and the fact that there's staff and volunteers and other people who are trying to help seniors who are precariously housed or homeless, and they can put them on wait lists, they can make calls, they can do whatever they can to try and help them. But at the end of the day, if there aren't the housing units available, this person is still potentially going to be homeless. And so that was a very significant challenge and frustration for the staff. And you can see there is a quote here. There's just not enough housing out there. And it's kind of this screaming into the void kind of situation is how I would put it. Filling out these applications for BC housing units, but there's no BC housing units and there's just no way there's going to be enough built. And so, where are these people going to go? Okay, so that summarizes the report highlights, and our report is quite lengthy, so it's 67 pages, so that's kind of just a Coles Notes version. But I wanted to provide some key highlights from the report, and then I'll talk a bit more about the report recommendations later on. But I wanted to pause now to see if anybody had any questions about any of the content of the report. If you do, you can feel free to put a question into the Q&A box or the chat.
Laura, could we arrange for the report, access to the report be put into the chat box, please?
Yeah, that would be great. Ravi, would be able to put a link to the report in the chat box?
Thank you. If anybody wishes to raise their hand to ask a question, that would be fine as well.
And I do see there are some comments in the chat, so maybe I'll just have a quick look here. So there's a comment about we have a 44-bed year-round homeless shelter in Cranbrook. 40% of the occupants are seniors mixed with homeless and people with mental health and drug-related challenges. This is unacceptable, and we've written the BC government asking for help with housing these seniors, waiting for a response. And so that's I know that's not a question, but that's an interesting issue, and one that we also found in the report, the fact that often the homeless shelters and then also the seniors housing buildings themselves, they might have mixed populations, or seniors might be placed in places with mixed populations. And there was concerns about that not being a safe place, particularly, as you mentioned, if people have mental health or addictions challenges. So that was something that came up pretty consistently as a concern in other communities as well. All right, I'm not seeing any questions right now. Oh, actually, there's one here. All right, and so we have a question. With the report release and other media exposure, has there been any response from the public and government to resolve these issues? And so that's a great question, and one that we'll talk a little bit more about later in the presentation. But just to give a quick summary now, we have tried to send the report, of course, to as many government and community and other people as possible. There's been a lot of different advocates and community members and organizations who have stepped up to share the report with their MLAs or their local media or other groups. So we have had, I think, a pretty strong media response to the report, and we've been able to get some attention there. I know that some communities have been sharing it with their local government. And then we have also been able to connect with the Ministry of Housing and to meet briefly with them to speak about the report. And we're hoping to continue to have more conversations with them about it. And then we've also been able to briefly connect with BC Nonprofit Housing Association, and we're hoping to have conversations with them about how to connect with service providers. So we have been having some uptake of the report and been effective in some outreach. And then later on in the presentation, we actually want everyone's feedback about how we can continue to do that. All right, great. Well, if there's no other questions right now, I'll hand it over then to Wendy, who I believe was going to talk about what the housing precarity situation looks like on the ground in Langley.
Thank you so much, Laura. Let me just get my slides here going. So Laura, you've done an amazing summary of everything, so thank you very much. What I'm going to talk about is what's going on in Langley. So for Langley, what we're seeing is a huge increase in the number of people, seniors, that are going to the shelters. As of right now, there's like 25% of this people are on relief mats. There's 40% in emergency shelters that are guests over 55. They also have a transitional home here in Langley, and 25% of the people there are seniors. This is unprecedented from anything they've seen in the past. When we talk about rentals, Laura is bang on. The rental rates are going higher and higher. And when we're looking at a senior who's bringing in $1,800 a month, right now we're seeing studios that are $1,600 for a studio. People are not able to afford any of these rates that are currently going on. Langley City itself has like 19.1% of our seniors are low income. So that is bringing the $1,900 in a month. And so we've got a very high number of people who are really struggling. Langley District, which is the township in Aldergrove, the percentage is lower, but still even 9.3% is high. But when we look at what we are seeing here in Langley, what's happening is when I was hired a year ago, they said, we don't see homeless people coming in. Now on a daily basis, we're getting calls from seniors who are either homeless or on the verge of being homeless. The struggles are huge. Things are happening, like their buildings are being torn down, and they're currently paying something like $800 a month for rent, and they can't afford the $1,600, $1,700 a month. We have people who are getting offered buyouts from the current landlord. The situation is becoming very dire in Langley. And, you know, we're talking about shelters. People don't want to go to the shelters because they don't feel safe in them. But even though the numbers are higher, we're also talking here about, you know, people are staying in locations that they don't feel safe in. We've got people who are being either, you know, abused or in living conditions that are not good. People are living in their cars now. Things in Langley are getting worse by the day. And like I said, every day we've got people coming in. We've got one gentleman who's living in his truck and he's got his dogs living with him. And he can't find a place to live. We've got other people who, like I said, their buildings are being torn down and there's nowhere else that they can find to live. And they're on the verge of being homeless. So things, hopefully we can make some changes soon. And that's what we'll be talking about in a bit.
Well, thank you. Thanks, Wendy, very much for that background information in relation to the situation in the Langley area. Ian, would you like to similar presentation in relation to Kelowna and Penticton?
Hi, everyone. Yeah, so my comments are low tech, but so I work in Kelowna and I'm with the Seniors Outreach and Resource Center. We provide a variety of social services for seniors and family caregivers, all aimed at improving kind of belonging, independence, and well-being. And as Tim mentioned before, I've been doing this work with seniors for 7 years, and already in that short time, I've seen a change. People used to, like a lot of organizations, we have an information and referral service. So people can walk in our door or call us, and we will help them with issues big or small. And they used to come in with housing and they want to know kind of how can I apply for the safer subsidy? What are my options with home support? What does assisted living look like? Do I qualify? How does that system work? How do I judge a good provider? And now we're seeing on a regular basis, people come in our door and they're already sitting on the edge of homelessness. And some people are already lost their home. And we're kind of seeing, you know, that we're really concerned, and the report captures it well, this trend of a lot of people, too many, who are having their first experience of precarious housing or losing their home after 55. And we kind of see two groups of people, perhaps not surprising. There's people who've just had setbacks in their life. You know, life happens. So somebody's had a car accident and they've had a brain injury, or they've had a life-changing diagnosis, or they've been a victim of fraud. Sometimes, unfortunately, by their own family member. Sometimes they've had a failed business venture or investments that have gone wrong. And other times they've been admitted to a hospital and they have a lack of a social network and they miss the rent payments because they've been in the hospital. And so just a lot of different things happen. And often a series of events happen that depletes their resources and they just find themselves in a really tough bind. And then you have another category of people where it's just the economics that are so tough on people and just being squeezed by the high cost of housing and the global inflation that followed the pandemic. So we meet people who, you know, comes from a generation where maybe the one partner stayed home. They're a homemaker like my mom was, right? In that generation. You get people who worked in the caregiving economy as daycare workers or care aides and had modest incomes and savings for retirement. We meet people who are their own business owners that they didn't set aside enough money for retirement, and maybe they managed a salon. And so you meet people who have been lifetime renters, had modest savings, and they just are being really squeezed by things. We also meet people who are family caregivers. And we're so proud in Canada of our public health system. And I think a lot of people are surprised that a lot of services for the kind of health services you need when you're older, they're not fully subsidized. It's a kind of worked on a kind of co-share model. And we need a lot of caregivers that are kind of surprised at. I'm supporting my spouse with Parkinson's or dementia, and they're in that funny spot of making more, so they don't qualify for fully public supported services, but not making enough that they can afford the private market. And they just get squeezed. And it doesn't take long before they burn through their savings because of the services they eventually need as the caregiving responsibilities get heavier and heavier. So you just meet the people and they kind of walk into our center, and they'll walk in the door already, unfortunately, doing the math with their 60-day eviction notice. And they're kind of saying, wow, I was paying $700 a rent, and now the market is $1,200, which is what it is in Kelowna for a one bedroom. So think about that. A senior on a fixed income is now an extra $5,000 or $6,000. And that's even if they can find the housing, right? This is and they start already talking about, what am I giving up to make this work, as far as medications or food or activities they like to do. And it's tough to hear, and it's tough on the staff. It takes an emotional toll on the staff too, right? That it's one thing to hear the story, but we all do this work because we want to help people find a way forward and improve quality of life. And it gets hard on the staff when you don't feel like you have options. Like Laura's talking about screaming into the void. You send these applications away, and it can be as long as over 3 years. You see the reaction in people's when it's almost a punch in the gut. It takes that long to get social housing, and I hear it all the time. I never thought this would happen to me. Or I worked my whole life in this, and it's just hard. And I just wanted to say too that some of the people who come in who are already homeless, I used to say when I worked with young people, we always talk about hidden homelessness. And now I know that hidden homelessness, it's not about age. It's just whether it's your first experience with homelessness. We see the same thing with the seniors. They're staying on somebody's couch. They're staying in the cars. Sometimes the seniors have more resources. They have a car to stay in, or they're making a deal with somebody they know to kind of have a trailer on their farm, that kind of thing. And they're trying to be resourceful. So there is that hidden homelessness we see. And I thought I would just end on just a personal story. One thing I really like about the report, there's great data in there, but there's voices from some of the seniors impacted and some of the service providers. And one person in the report is a woman named Lucy. And she was from our community. And when we met her, she was already staying in a car in the parking lot of a big retail partner. And that's where our staff met her. She was one of those care-aides that in order to have a full-time job, she had 3 part-time jobs combined together to make it all work. And at the start of pandemic, she was already at 70. And she thought, and you remember those early days in the pandemic, before the vaccinations, before we knew it was going, and we were seeing these scenes from other parts of the world, it was scary. And she thought, you know what, I think I'm going to sit this one out, and it's maybe time to retire. And little did we know that the housing market was going to take off like it did. And she was staying in a rental that was a secondary rental, so not a purpose-built rental. She's staying in a suite in somebody's house. And this person decided this is a good time to sell the house. And we see this a lot, that BC leads the nation in no-fault evictions. This was legit in this case, but there's other times where we see somebody, the family member moving in or renovation happening, and you kind of wonder if it's really happening or not. And but this time we knew it was legit, and you can't blame this person. That's what they did, is buy low, sell high. He was going to sell the property. But Lucy was impacted in a big way. Of course, he's selling in the summer when it makes sense to sell. And in Kelowna, there's almost nothing available. There's this whole Airbnb dynamic of people have rentals at a higher rate May to August. We can help a senior sometimes get something if they walk in our door in October, November. If it's summertime, it's really tough. And she was one of those people, right? Just this huge increase of trying to find a place at 1,100, 1,200. Fortunately, in Lucy's case, we had a housing navigator and a community connector. We basically introduced her to shelters. As Wendy kind of said, it was a really intimidating experience for her. A lot of the shelters, they have a harm reduction approach. And if you're not used to seeing kind of substance use, and some of the people who have been in chronically living on the street, it's different, right? We worked hard to get her a place where you have common areas for eating and for washing and showering, but this place actually had your own room. So she pretty much just stayed in her room. But they did tell her that this shelter was for people with substance use or people coming out of recovery. So she could get bumped, and she did. She got bumped because someone was coming out of an addiction center and they needed that bread. So she was in a shelter, back to the car. In the car, she ended up getting blood clot because of the lack of movement, the lack of hydration, and she was admitted to the hospital. So then our community connector was involved trying to remove barriers to getting surgery, such as, when you discharge you from surgery, you have to have a place to stay for 48 hours and have support. And how are you going to pay for the blood clots? We don't want to do the surgery if you can't have the medications after. So both the housing navigator and community connector really worked hard to remove different barriers for Lucy. So it was kind of shelter, hospital, shelter. Eventually, it was a good news story. We did find a place from another nonprofit housing provider that had housing. Originally, there was housing that was supposed to be temporary for people in recovery, where the shelter environment was maybe not appropriate. And over time, because there was a lack of housing, it had turned into this permanent housing. And that's actually all women that are in these 16 units, people like Lucy. But she was one of the success stories that, in the sense that she was able to get that home. I think the last thing I'll say is just a reminder that that group that we sometimes see in our community that are living without a home, it's not static, it's very dynamic, it's always changing. There's probably 80% of those people are the Lucys of the world, where they, because of our system of care, they can bounce back. But there is a part of me, and I think what this report begs us to ask is, how do we still prevent that situation to get that hard for Lucy and get that extreme? Like the system of care, here's a woman who cares for others in these care homes and spent almost 3 decades doing that. And I feel like the system of care wasn't there. Thank you.
Ian, thank you so much for the story. The stories are so powerful, and to hear more about Lucy's situation and what took place there is a huge learning opportunity as well. Thank you, Ian, and thank you, Wendy, for your two perspectives on your respective communities. What I'd like to do now is move forward and ask Laura to come back, and if you would just talk a little bit more about the report's goals and recommendations. Laura.
Yeah, thank you very much, Tim. And thank you very much, Ian and Wendy, for those very impactful perspectives on what's happening in your community. And so now I'm going to talk a bit about the report goals and recommendations. And we do in the report have some pretty extensive information about the goals and recommendations, but I'll just provide a brief summary. So in our report, we have 2 different sets of goals. The first set of goals focuses on how we can increase access to low-income rental housing for all age groups. And so that's in recognition that, of course, across the province, there's many different groups who are being impacted by the housing affordability crisis. And there's a lot of solutions that would be good, not only for seniors, but for other people as well who need that affordable rental housing. And so the goals that we have in the report are, first and foremost, to increase access to subsidized rent geared to income housing for low-income people of all ages. And that's housing where you pay no more than 30% of your income. And so we see this type of housing as critical because it ensures affordability for the lowest income members of our society. So really, this is vital. And as has been mentioned before, unfortunately, there's not enough new subsidized housing that's being built. And then also we're losing units due to expiring operating agreements. The second goal in the report is to retain the existing stock of low-income rental housing for all age groups. So it's not just, of course, about building new housing, but we also have to protect the current affordable and low-income housing options that we have available. And so that includes protecting those subsidized rent geared to income units that have expiring operating agreements, but also considering other types of housing that traditionally have provided options for low-income people. So for example, older 3- or 4-story apartment buildings, or motels or places like trailer parks or other places where if you're very low income, you can at least find some decent housing. And unfortunately, a lot of these options are being lost to redevelopment. And then also needing to ensure that the private market options that we have available, renting through a private homeowner who has a basement suite or other options like that, also stay affordable. And then the third goal that we have is to develop multi-sectoral community tables, coalitions, or alliances to identify common housing issues and develop community-driven solutions. And that's because we recognize that housing precarity can look very different if you're living on the downtown east side of Vancouver versus if you're living in a rural community in northern BC, or if you're living in more of a vacation community like in the Okanagan. And so we know that there needs to be that community conversation in order to identify what the challenges are and also what the solutions are. And so in our report, for example, we highlight the 100 More Homes initiative in Penticton and the Alliance to End Homelessness in the Capital Region as two good examples of community coalitions that have come together in order to address housing and homelessness issues in their community. And so along with these three goals, we have a number of specific recommendations in the report, just to highlight a few examples of them. So some of the recommended program and policy solutions in the report include, of course, the fact that government and the federal and provincial government both need to increase investments in affordable rental housing, as we know that nonprofit housing developers can build the affordable rental housing that we need, but they do need to be supported adequately by government in order to do so. We also recommend that local governments consider what policy levers they can introduce in order to accelerate the development of low-income rental housing. So, for example, local governments can take steps such as fast-tracking nonprofit housing developments, or they can, for example, defer or exempt these organizations from needing to pay property taxes for a period of time. So there are various steps that can be taken in order to make building rental housing for low-income people more affordable, or to make building it less time-intensive or cost-intensive. There's also opportunities to enable access to free or low-cost publicly owned land to build new housing, because we know that the cost of land is one of the most significant costs of building a new affordable housing building. So in that case, if government has publicly owned land available that could be used, that could significantly decrease costs. And there's been work that's been done to research in communities what types of free publicly owned land are available that could be offered for free or at a low cost. Another example is housing acquisition programs, which the government of BC actually has already provided $500 million towards. And so these types of programs can be used to protect existing rental housing buildings and ensure that they remain in the nonprofit sector and aren't purchased by private developers who want to turn them into a new high-rise tower or something like that low-income people won't be able to afford. It's also important to consider people who are renting on the private market, and vacancy controls are one policy mechanism that has been advocated for, because we see that government does limit the amount that you can annually increase the rent if you're a landlord. However, if there's a change in tenants, when the old tenant leaves and the new tenant comes in, you can increase the rent as much as you want. And as Wendy alluded to, this is creating an incentive for landlords to get rid of their long-standing tenants like seniors and then replace them with a new tenant who they can charge a much higher price to. So there needs to be some sort of policy in place to prevent that from happening in the private sector. And then another example of a program option is home repair grant programs. And this particularly is a solution that might be needed for rural communities, as we do know that there's issues where people might be living in housing that they own, but there's maintenance or other issues that make it very unsafe or uninhabitable. So for example, if you have that broken window during the middle of winter and you're living in northern BC, that's a very hazardous situation. And so if there was a grant program that could provide a little bit of money to get that window fixed, that would be very beneficial for the seniors. And then the other sets of goals that we have in the report focus on the specific needs of older persons, as we do recognize that older adults do have some unique needs in terms of their housing and support needs. And there's a need for programs and housing that's tailored towards that. And so the goals that we have here are to increase the financial assistance for low and moderate income seniors living in private market rental housing by introducing needed changes to the SAFER program. And SAFER is the Shelter Aid for Elderly Renters program, which provides rental supplements for people on the private rental market. But one of the key critiques of this program is that the amounts provided are not in line with what the cost of a rental actually is. So there's a need to review the current amounts being offered and to increase them. Another goal is to increase access to housing with supports to help low-income seniors maintain their housing and improve their health and well-being, because it's not just about finding housing for the senior, but it's also helping them to stay housed and to stay well in that housing. And then the final goal is to ensure that housing navigation supports the shelter system, transitional and low-income rental housing are not only adequately funded, but also accessible, safe, and appropriate for seniors who are homeless or precariously housed. As we know, of course, we need more housing options and services available, but they also need to be appropriate and tailored towards the needs of seniors. And so some of the specific recommendations that we have related to these goals include, for example, increasing SAFER amounts to better align with the rental market. There's also a need to develop funding streams to support community-based organizations to provide on-site tenant and social connection supports. And in the report, we provide examples of programs such as the Whole Way House model and also the SRO Hub model, which provide these types of on-site supports, as we know that often the tenants of low-income rental housing are going to be more vulnerable and might have more support needs. We also suggest expanding access to seniors' supportive housing, which is a type of housing for seniors that provides that little bit of support, like the meals or the housekeeping, and can help to keep vulnerable seniors housed for longer in the community. There also is the need to increase access to multidisciplinary mental health services, as that was a common concern that was raised, the fact that we need more mental health supports. We should support and expand access to the Seniors Housing Information and Navigation Ease, or SHINE program, which is a program that's led by Senior Services Society in New Westminster and with partner organizations in several communities across the province. They're able to offer tailored housing supports and navigation supports for seniors. So expanding a program like that would be a good step. And then also investing in transitional housing models for seniors, because as we've heard, homeless shelters often aren't a safe or appropriate site for a frail low-income senior. And so if we can consider a transitional or temporary housing model, and there's examples of these types of models that Senior Services Society runs or other organizations in BC. And so if we're able to provide a temporary housing option that a person can stay in to get back on their feet until they find regular housing, that might be a much more appropriate setting than a homeless shelter for a senior. And so these are just some of the examples of the recommendations that are associated with the goals for the report. And of course, I would invite you to read the full report and look at the recommendations section to find out more about what we recommend and the rationale behind it. But this is just a quick summary. All right, and so now I've provided my summary of the goals and recommendations. So I'd like to hand it over to Wendy and Ian then, so that they can both talk a little bit more about the goals and recommendations and how they relate to their community, and also what they're doing to advance advocacy in their communities.
So it's Tim here. Can I just interject for a moment, Laura?
Oh, yes, of course.
Ali's got a question. If you wouldn't mind looking at the question that Ali's
Yeah,
asked.
for sure.
And then we'll jump to Wendy for the that particular piece.
All right, so Ali said, I lived in Vancouver for 25 years and I've heard of these kind of solutions over the years. However, I keep seeing buildings being torn down for major developments, increases in Airbnb, and incredibly steep rental increases. How many of your recommended solutions have been attempted in the past to no avail, and what are the barriers? Yes, so I think that's definitely a challenge, is that this is an issue, housing precarity, that we've been working on for many, many years. And there have been a lot of solutions that have been recommended or tried, and then they're gotten rid of, or there's challenges. So I think it's definitely something that's going to be a long-term project in terms of trying to get these recommendations acted on. There are some examples of recommendations such as vacancy controls, which actually were in place for a period in BC, but then were scrapped by one of the governments and haven't been reintroduced since. So some of them actually do have a history, and in the past were thought to be a good idea. And I think now with the changing housing crisis would be a good idea to reconsider. And then I think there's also certain solutions that, given the current government, I think we have seen is quite interested in the housing issue. And we see that they are taking steps to try and address some of these issues. So for example, the Airbnb restrictions that have been implemented. I think there's a bit of a policy window in terms of the fact that there's current interest from the government in addressing this issue. There's public pressure, and there's the need. So I think there's that opportunity to try and advance some of these recommendations. But I think, as you mentioned, it is for sure a challenge in that I think this is a conversation we've been talking about for quite a while, the housing needs and housing affordability crisis in BC. And we want to see action, which is something that we all feel here.
Thanks, Laura. So Wendy, your perspective on the next question then.
So let's start this again. Here we go. Sorry, having technical difficulties. Hold on.
So this perspective is on examples of how the report is being used to support local advocacy in your communities.
Yes. So Laura was bang on when she was talking about now is the time. I think now is the time for us to raise the concerns and really advocate for our seniors. So Langley, we sort of, what we're looking at is, how can we advocate for every senior that walks through our door? How can we support them the best we can? We're looking at joining community groups in the area for development through the city, through the township. We've also created a committee specifically here in Langley, pulled together different representatives to sort of see how can we look at this report that's been created and what can we bring forward and changes we can make here in Langley. The key is raising awareness, because this report covers so much and we need to, use this amazing information that's being created by Laura and the team here. So like I said, we've created this housing committee, just started last week. What we did was we gathered those people that we felt would make a difference for seniors. So we looked at health authorities, we looked at people who deal with homeless, people who deal with even addictions, shelters, everybody who BC Housing, a lot of seniors who are very involved in the community out here. And we went through the report, we looked at all the recommendations, we looked at all the goals, then we looked at which ones do we feel are most relevant to Langley, and which ones do we feel we can actually make a difference on? So some of the goals are things that we can do now, so we're looking at getting, some funding to subsidize housing for people. But then it's also, what can we do in the future for housing and developments coming forward? What we recommend is that every community looks at their tenant relocation plan. Is there changes that can be made to that? Is there changes that can be made to the, what's their housing action plan? What things are being done and what's a best practice? We've looked at other cities, what they've got created, and we're going to look at what would be, we feel is the best for the seniors in our community. And so it's getting the data, it's looking at the reports. We're also looking at current developments, and we're looking at, are there suites in that building that maybe a different property management group can come in, and they can be for people who are going to be subsidized rent geared to income suites. How can we make some of the suites accessible for seniors? What kind of things can we do? What kind of changes can we make? We are looking at, we've got a meeting set up with the MLAs, MPs, and our mayors to talk to them about some of our direct questions. We've got a hotel locally that is sitting vacant. Can we turn that into a transitional home for seniors? So we're looking outside the box. What can we do? What kind of things can we, as a community here, tackle and make a difference on? We're also bringing our concerns to the Chamber of Commerce. We've got the seniors advocate coming and talking to us, I think, in February. Just trying to get the word out there and determine what's best for us. That's what our sort of goal is at this point. Just looking for creative solutions for people. We're also talking to a lot of seniors about moving to another community, like, no offense, but sometimes they can get better prices somewhere else, depending on what people's needs are. So it's not always easy for a senior. You don't want to make changes. You don't want to leave where your doctor is. But we're looking at, another thing we're looking at is creating a community board where people can sort of put their, who are they wanting to share a room with? Room shares. Let's look at outside the box. What can we do? So we're tackling it from every angle we possibly can and hoping we can make a difference, because now's the time. Thank you, everybody.
Well, thanks, Wendy. That's tremendous. So much going on in your community. I think we could learn a lot from what you're doing and the success I'm sure you'll get from those discussions and conversations you're having. Ian, your perspective, please.
Yeah, I think some of the ways that we've used the report is both the city of Kelowna and the city of West Kelowna have recently gone through a housing needs assessment and having to do a housing strategy. And I think there's some new provincial guidelines where local municipalities have to do this they have to renew these things after so many years. And it was helpful for me to refer to, there's a section in the report on different levers for local government. And I think sometimes the best sermon is a good example. So being able to point to other communities and some of the things they've done was helpful. I think also ensuring a senior's lens or perspective is when they do these consultations is always there. And we had not only our staff, but we actually had some of our participants show up. A pretty powerful session we did with the city and the planning department, with talking about some of the experiences they had. Getting them to commit to metrics. I think it was Ali was one of the guests, talked about what's been the change. I think there's been good stuff happening, but you have to look at the net, right? So you build new housing, but if you lose housing over here, it's come a wash, right? So it's just really getting people to focus on the metrics and to be creative. Part of what we're doing is advocating for the services we already have. Like we talked about that, we're part of that SHINE collaborative, Seniors Housing Information and Navigation. Boy, I can't think how our organization would look and how some seniors would be if we didn't have that full-time housing navigator. That's all she does, respond to housing related calls, and it's a full-time job. And it could be two people on both sides of the lake in my community. So part of what we're doing is just making sure. I had a meeting just yesterday with one of our MLAs because it's coming up to the budget year again, and reminding them how important that program is, and the need to ensure it's still there, and to think of ways that it might expand. Just of course advocating for seniors housing all the time. That when BC Housing is approving things, that they look at it from a balanced portfolio point of view. There's such an emphasis on shovel-ready projects. But maybe if there's no seniors housing in your shovel-ready projects, you have to look at one of these ones that needs a little more support to get it where it has to get. And I think the last thing I'll comment on is, so I used to work in Manitoba, and I've been in BC the last 10 years. I think I took for granted the access I had to a minister or a deputy minister or even a senior policy analyst when I worked in the capital. It was easy to kind of sometimes get a meeting and share what you're seeing in the community, or even have a chance to influence policy. But when you work outside of it, I thought what was neat about the experience I recently had with the United Way and the partners around the table is you felt like you maybe had a bit of a voice in Victoria for a moment. There was a lot of interest in the report, and we decided to focus on the safer rent subsidy. A lot of the federal government and province, I think, are doing some really neat things, but we won't see the impact of some of that stuff for 3-5 years. It's about building new housing, and just the federal government alone saying that 5%, they won't charge GST. All of a sudden, all kinds of projects that were being held because of interest rates and high construction costs became viable. But you won't see that for a while. So I would love to see the province do something with the safer rental subsidy. I think it's a real quick way to help a lot of people right away. They haven't looked at that formula since 2018. In my community, the formula they use to determines a senior subsidy, they use a rent ceiling of, I think it's just under $750. Yet our average rent is over $1,200. It's just not connected to reality. So I'm sounding like a broken record when I'm traveling in different circles to look at that. See, I know you've done a lot already, province, but keep being creative and keep being bold, because the seniors, they need it, they deserve it, they've earned it.
Well, thanks, Ian, for that perspective from your two communities, and a Manitoba perspective as well. And thanks, Wendy, for your comments and feedback on the perspective from your communities. In the chat box, we have a chat question, actually, and also we have a question in the question and answer box. I'd like to just jump to the chat box first. Not that I've got an answer to Corinne's question. Corinne, is interesting. Nice to hear you or see you there, Corinne, because you and I have worked together for many years on the development of a dementia home in Kitimat. So I'm delighted to see you part of this conversation today. But I'm going to ask Laura if we can respond to Corinne's question.
Yeah, well, I don't think I'll be able to fully answer it because I'm not fully up to date on the grants that are available through BC Housing. But maybe I can just comment that this is definitely a challenge that I know has come up in our interviews and communities across BC, that there's a big emphasis, I think, right now on just building kind of mixed housing that's affordable, which of course does have its benefits, but at the same time is not always appropriate for the seniors. So I think that's something that we need to, as a group of interested people in this topic, try and advocate for and engage in communities with BC Housing or other stakeholders around the fact that there is still a need for senior specific housing. And so I think that's something that we're hoping to be able to have some conversations in the future with policymakers about. But sorry, I'm not able to provide any other information beyond that.
Oh, thanks, Laura. Thank you. It is part of the ongoing work that we as a housing group are going to be involved in when we have those discussions with BC Housing, the Ministry of Housing, etc. So I'd like to just move to there's a question in the question and answer box. Again, it's with the current push to increase immigration to levels of 500,000 people per year in Canada, how do you create more housing for seniors? And when there is so much pressure on the need for housing in general?
Yeah, and I think that's definitely a huge challenge is the fact that there's many other pressures on the housing sector as well. And that's why in the first set of recommendations in the report, we didn't focus exclusively on seniors housing, but more broadly on how we can increase affordable housing for all, because I think there are many different groups that are going to be in need of housing for in the future. And if we're able to work with people to create housing for all, that would increase, of course, the strength of our advocacy and coalition if we're able to get together a larger group of stakeholders, but also just more generally benefit everyone. Because I think it's important that we want to recognize that seniors have specific needs and that there is the need for seniors housing. But at the same time, we don't want to be divisive and suggest that, oh, certain groups deserve housing more than others. So I think it's really looking at that broader picture of how can we increase housing for all, and then also that more specific picture about and how do we make sure that all of the different groups are having their needs met. But definitely I think that is a huge challenge, and there's going to be increasing pressures on the housing market from many different areas in the future, and so we really need to make sure that we're advocating for action.
Thanks, Laura. Thank you for that feedback. So what I'd like to do now is move us on to the next item on the agenda, which is more of a discussion, a questions period of time. We have with us still 35 participants, which is wonderful. And we have a couple of questions. I don't know, have we got a slide with the questions on, Laura? Please.
Oh, yes. Just let me share my screen. Just give me a moment. Oh, I've got to go forward.
Thanks, Laura. So the first, this is an opportunity for everybody to participate. So we look forward to hearing from everybody involved in today's webinar. So the first question that we have is, what goals or solutions from the report resonate the most with you? So from your respective communities, we'd like to hear more about which goal or recommendation really will impact your community in a positive way in relation to seniors housing. I'll throw it open for questions, comments, thoughts. To take the opportunity here to sort of start the discussion, hopefully that we'll have more feedback. From my perspective, I've worked in the healthcare system all my life, particularly in relation to supporting seniors to remain independent in their home, in their communities. And I think one of the solutions that resonate with me in particular and goals is the importance of the partnership, the collaboration that must take place between housing and health, not only at the provincial level, at the regional level, but also at the local level as well. So the benefits that would accrue from health and housing, particularly with BC housing organisations and other housing organisations, we've seen models of this already working successfully in relation to assisted living, which was an initiative that took place in the early 2000s, which is an incredibly important service that's offered to seniors, needs to be expanded along with supportive housing. So from my perspective, from being a health service provider for many years, that linkage, that cooperation, that collaboration between housing and health is absolutely critical, whether it's mental health services, home support services, or general community nursing services. An important component where we need to work together much closely. And I'm going back to Corinne in Kitimat, because interestingly enough, Corinne, who is a member of the housing organisation in Kitimat, and the Health Authority have worked together and us working together as we speak in the relation to developing a dementia house, a dementia home for 8 residents in Kitimat, which is an amazing partnership that's evolving, and it will come to fruition in the foreseeable future. So that's just one example of a close collaboration that will produce a successful outcome. So other thoughts and comments from others, please. Laura, I think we have another question.
Oh, I think so in the Q&A box, Corinne had identified that goal 1 would be the priority that resonates with her to increase access to subsidized rent geared to income housing. And then we also have a comment in the chat, and this is from Lori. And she says, I envision decades into the future when the baby boomers have all passed and all these buildings we are creating being empty. This lends weight to the idea of incentivizing home sharing type projects and continuing to build new units to meet the immediate demand.
Yeah, thanks, Laurie. That's a thought that often goes through my mind. It will take us time to develop all that we need to meet our current needs, and then in the future, as the senior population does start to decline because of the baby boomer situation, yes, we may end up with a surplus, but that could be addressed with higher immigration numbers as well.
And then I think Susan has a comment.
Sorry, I don't see Susan's comment, Laurie.
Oh, I think Susan was put up her hand to speak, though we can't hear you right now, Susan.
Sorry, and I can't speak, and I can't see you, Susan.
I still can't hear you, Susan. Maybe you could put it in the chat. Okay, Susan will put her comment in the chat.
Okay. Any other comments regarding goal solutions that resonate? Okay, so what I'll do then is just move on to the next question we have. Again, how do you think we can continue to build momentum on the issue of seniors housing precarity in 2024? Again, we would like to hear your thoughts and ideas on how we build momentum to address this issue of seniors housing precarity. We've heard from Wendy and Ian, particularly in their respective communities, on the momentum that's currently taking place in those communities. It'd be lovely to hear from other communities on what is occurring there as well. I think at this stage we must have Susan, thank you for your note. I'll ask Laura to respond.
All right, so we have a few comments in the chat. So Susan noted, as a municipal councillor, knock on your councillor's door to ensure that their advocacy is informed and aligned. And so I think that's a really good suggestion. And I know that some communities have already been doing that, try and reach out to their local government. And I think that's a great suggestion, thinking about not only, of course, the provincial level advocacy, but also the fact that municipal governments do play a large role in housing policy in each community. And so we need to be reaching out to them as well. And then Marion said, I think one of the most important aspects of the report is the call for rent geared to income subsidized housing. So reiterating that point that we really need that 30% rent geared to income housing. So thank you for that comment. And then Lori suggested, keep advocating loudly, keep connected with local governments as well as provincial and federal. And they've seen good increase in local buy-in since age-friendly Cranbrook got active. Thank you for that comment. And then Lynn has suggested that coalitions of representatives from nonprofits, public agencies, faith-based groups can be encouraged to work together, but many organizations do not have the capacity to donate their time to meet, plan, identify, and secure funding and implement grant funds. And these groups need funding for coordination by well-informed facilitators and to allow representatives to fit this work in their personnel work plans. And I think that's a very good point regarding community coalitions or alliances, because the two that we do profile in our report, I think one of the key facilitators that helped them to be successful was the fact that they did have some funding and backbone organizational support in order to help keep the coalitions together. So I think that's a very good point, and something that I know I'm hoping to explore is to look into more potential funding sources that could be used by groups who want to form these type of coalitions, and to see if there's any sources out there that would be useful for that. But I think that's a very important point.
Thank you.
And then there's another comment by Jennifer. I would like to see organizations who have subsidized housing that is coming to a conclusion to the agreement have a clear path of how to continue with the subsidizing of the seniors' housing. I think it will be imperative that these subsidized facilities do not lose that ability to subsidize seniors. And that, I think, is a very important part as well, how we can work with these organizations in order to continue to ensure that it will be financially viable for them to offer the subsidized housing. Because I know these housing providers, they want that, but in some cases, just financially it's not viable for them anymore. So I think working with them to see how we address this issue is very important as well. And then I think we have a few more comments in the Q&A. So Corinne also said, in Kitimat, we're planning a door-to-door survey of all residents regarding housing. We're working with the district of Kitimat, and they're addressing the vacancy rates that are not accurate, as the housing in the report is mostly not habitable or not accessible for seniors. And so that's a very important part of the picture as well. I think having accurate data about what the actual situation is on the ground. So that's a great suggestion as well, collecting data.
Yes, thank you.
And there's one more comment from Lori about mixed housing is a real fear for some of our clients, especially mixed with families, because there's noise issues and people with severe mental health and / or addiction issues, because there's stigma. We have a lot of family housing. And so I think from these comments, there's certain, it seems, kind of themes that are coming out. One, of course, is that issue. We've had several comments and questions about the mixed housing. So I think that's definitely seems to be a priority that's on the mind of people in the webinar. And then also that idea of the local community advocacy and work, because there's a lot of great suggestions here about how we can locally on the ground try and influence change. And then, of course, we can also hopefully address some of the provincial levels as well with our advocacy. So I think these are really great suggestions.
Yeah, thank you. We just have a couple of minutes left for this piece of the part of the agenda. Does anybody have any further comments or questions around regarding both questions that we identified for discussion? Tremendous feedback. Thank you, and comments and questions. Very much appreciated. Laurie, I'm just wondering if you could share in the chat box your contact details, so that if anybody else has comments to make or questions to raise with us, they could connect with you.
Yeah, for sure. So I will put my email address in the chat box.
Thank you. I don't know what we would do without Laurie. So Laurie, I have to say at this stage, thank you so much for everything you're doing for us as a working group, and for all the communities across BC in relation to the work you've undertaken, the research, the authoring of the report, the facilitating of conversations. It's been wonderful. We wouldn't have been where we are today without your assistance. So thank you, Laurie, for everything you do for us.
Thank you very much. It's been a pleasure working with so many people who are so passionate about this issue.
So what I'd like to do at this stage, we really conclude the webinar today. And first of all, say thank you very much, particularly to our presenters today, Wendy and Ian, and the participants as well, and your comments and questions have been really, truly appreciated. As the co-chair of the Seniors Housing Advisory Group, we will be developing a strategic action plan to continue to pursue advocating for seniors housing across British Columbia. We've already had a number of conversations with ministries of housing, Ministry of Health. We've had connections with BC Non-Profit Housing Association. Laura and I were at the conference in November and had an opportunity to talk to many participants there who were interested in this particular topic. So what we propose to do is continue to have many conversations across the province of British Columbia with municipalities and with regional districts and with any other seniors housing organizations to really move forward with these goals and recommendations that we've identified in this report. As a seniors housing group, we will be meeting again next week, and this will be one of our key activities for 2024 is to continue the advocacy work that we need to do to be successful and to achieve the goals that we've identified. And if anybody wishes to participate or be involved more in this work, then we would love to hear from you. We would appreciate hearing from you. And I think we have much work to do. So in conclusion, I would like to say thank you to everybody. I hope people found this useful. If you have any questions or information needs, please don't hesitate to contact Laura, and we will get back to you as soon as possible. Thank you all very much.